Shoulder replacement surgery is a very common surgery. Many of our Suncoast viewers can attest that the recovery can be rough, and the procedure used to be a one-size-fits-all situation, right? Not anymore. Once again, the Suncoast is making history. A well-known doctor, Dr. Christopher Dillingham, is introducing a new way to perform the surgery with robotic arm assistance. Dr. Dillingham, let's talk about Mako robotic arm surgery, if you don't mind.
Yeah, so robotic arm surgery is unique in the fact that we've been doing shoulder replacement for years. And we know for a fact that the most important thing is if we can align the shoulder perfectly. The robotic arm isn't causing a whole new surgery for me to do. It's just allowing me to do it better and more precise.
That's exactly what I was going to say. What is the difference? Because you're saying it's going to be more effective and more efficient, right?
Correct. So my knee and hip replacement colleagues have been using Mako robotics to do knee and hip replacements for 15 to 20 years. Now we're bringing that to the shoulder, and they've proven that they can align the knee and hip better, which makes it last longer. And we're going to do the same thing with shoulders. So instead of us worrying about 15 to 20 years from now, when we do a shoulder when you're 65, you're 85 at wearing out, now this shoulder is going to last you forever.
So yeah, you're exactly right. This is not a new surgery. It's a new way. It's a new way that you go ahead and work on the shoulder, correct?
Yes.
The Mako way.
So we use the shoulder laser to get real-time feedback to where we're positioning things. You can see here, so the robotic arm doesn't allow me to move my arm outside of where it needs to go.
It's incredible.
And it uses the sensors there and a pre-op CT scan, three-dimensional image to match your body perfect.
Yeah, and we have a picture. We're going to show you what a irritated shoulder looks like, right? And then describe what we're seeing right here.
So on the left, you see your shoulder. It's essentially like a ball and socket. So it moves like so. The joint surface wears out. So it's analogous to a tire on your car.
Makes sense.
The tire over your life starts to wear out, and eventually there's no surface left, which is painful.
Which is what you're seeing on the right-hand side here, correct?
It's red and irritated and mad, and you don't sleep at night, and you're pretty much unhappy all the time. And
one of the things that I find unique, you're the only one that is doing this type of surgery in this area, correct? When it comes to the shoulder surgery with the Mako procedure, correct?
So currently the shoulder is just being launched at a few centers across the U.S. And then over time, we'll teach new surgeons how to use this and hopefully bring it to a broader market.
Which brings me to my next thing. We talk about the Suncoast and how special it is and how great it is to have you here. You are not just only impressing people on the Suncoast. You have actually impressed the people with Mako. They have asked you to actually teach other surgeons how to do this as well, correct?
Yes, the goal is eventually we'll roll this out so multiple people, not just here, but all across the country will be using Mako so we can have better long-term results with our shoulder replacement.
And again, this procedure, I love this picture right here. This procedure is hopefully going to make the surgery more efficient. It is going to make the recovery in less time, correct?
So people will recover quicker, and most importantly, it's a long longevity.
Okay.
Shoulder surgery, any surgery you have, is a big deal for you. It's a life-changing event, so we only want to go through it once.
Exactly.
So we want to make sure we do a good job. It's essentially like changing the tires on your car and then aligning the car perfectly.
Yeah,
and it holds up for you.
Yeah, and with surgeries, nobody wants to do it, like you just said. You know, so a lot of people will hold off as long as possible. Am I correct?
It's a scary situation, for sure.
Scary.
It's a big deal.
So to have you doing a procedure that is using a robotic arm, only doctor in this area, to make it more efficient and to make the recovery less painful. I mean, it's outstanding. Yeah. What would you hope some of your patients will say after they've had this surgery? What do you hope they tell others?
Yeah, well, it'll be interesting because I have a few patients, we've already replaced one side, and now they're going to come back for their other side. So I'm hoping they say it's faster, it's quicker, it feels better. Of course, we all think we do a great job, but when I talk to some of my knee and hip colleagues, they say people even do a little bit better when they use the robotics.
Tell us your website again so people know where to get more information.
Yeah, so you can find us at SforzoDillinghamStewart.com.
SforzoDillingham.com if you want more information. Thank you so much.